We can now speak to the Stellenbosch University researcher, Professor Martin Gustafsson, who's been saying that the World Health Organization is not clear on when schools should reopen. He joins us by Skype, I believe, this afternoon. Prof, a very good afternoon to you. Thank you so much for your time. I want to begin with that thread that was raised by the Human Rights Commission about how the closure of public schools at this point disadvantages pupils at an educational development level, because I know you've done some research on that subject.
Yes, afternoon, Tembekile. I haven't said that the World Health Organization doesn't know what to do about schools. What my concern in an article that came out today was that the perception in South Africa seems to have been created that the World Health Organization believes that schools should not be open at particular points in the pandemic when there's community transmission or when deaths and cases are on the rise. So the point that I think, that I've been making is that that's based on a 1-minute video clip with Michael Ryan from the World Health Organization. It's important to remember that the official policy of the World Health Organization is to provide a set of criteria for taking decisions, and those are quite detailed, but the World Health Organization does not, for instance, say we should not have our schools open right now. And then on your question around educational losses and the concerns of the South African Human Rights Commission, there's a lot of work happening on that right now. Educators, health experts are very concerned about the effects of children not being at school. We know that, if children are out of school for, say, 3 months, they actually lose more than 3 months of learning because there's a forgetting factor. And so recovery can be really difficult. And in particular, I think we need to be especially worried about the very youngest learners, the foundation phase learners, because the foundations, the learning foundations in reading, numeracy, and so on, it's a very delicate process, and it should not be interrupted. Interruptions should be absolutely minimized.
And apologies for misquoting you there coming to the conversation, Prof. Just on the point that you're making about the lower grades, a lot of attention, even in that plan detailed by the President yesterday, focuses on grades 7 and 12, because obviously grade 7s are advancing into high school. As their next move, matriculants will go to varsity or whatever decision they make about their future post-school, right? But is that the right area of focus, just focusing on those 2 grades in terms of the urgency with which they need to go back to class?
A lot of experts would say that we've underestimated the harm that is being done at the lower primary level. I would agree with those who say that we should actually prioritize those young learners, get them into school as soon as possible, both from a learning perspective, but also from a nutritional perspective, and keeping in mind that our school nutrition program is massive, but it also means that any disruption to schooling has a particularly detrimental effect on nutrition of young children in South Africa. And
government has said that the feeding schemes will continue. They had to be taken to court over that commitment in the last few days. One of the other things you've spoken about is research that's found that without catch-up lessons, the skills of those completing matric would be lower than in a no-pandemic scenario, which suggests, though, that we're likely to face, aren't we, serious problems even beyond the immediate term as far as the quality of our passes even.
Yes. Obviously things are still very uncertain. The world has never experienced something like this, but some of the modeling I've done using models developed outside South Africa point to the very real possibility that our grade 12 outcomes in terms of skills in critical areas, mathematics and so on, could be lower than expected for many years, not just this year or next year, but for the next 10 years. Which points to the need to really have good catch-up programs and to interrupt school as little as possible, and to also be very, very clear about what the evidence says. I mean, the Human Rights Commission has correctly pointed to evidence that the World Health Organization endorses, that children are low transmitters, and that if teachers are being infected, they are, in nearly all cases, would not be infected by learners, especially younger learners. So I think there's a need to look a bit differently at younger and older learners. I don't think there's been enough focus on that. And I think let's also be clear about what South Africans want. I mean, the debates can't be driven by middle-class concerns. I mean, I see that there are statistics that have been doing the rounds of, 60% of parents don't want their children at school. I don't think that's believable. Those statistics are based on an online survey where people voluntarily participate. No amount of weighting or statistical adjustment can really make that representative of the population. What's important to note is that the Department of Basic Education has been monitoring attendance, and it's lower than normal, but quite high. So in Limpopo and KwaZulu-Natal, for example, it's about 90%. Now, parents currently are not forced to take their children to school, but clearly there's a very high demand for schooling among parents.
What complicates the schools debate, Prof, very briefly, is that it's one thing to deal with the science, be it from education researchers, be it from the likes of the World Health Organization on COVID transmission, but this is also quite an emotional decision, and people cannot rely solely on what the data says.
Absolutely, but it's going to be an emotional issue. Everyone is worried, and people have reasons to be worried. But I think one of my concerns is that the evidence, I don't think, is coming through clearly enough. And I think researchers like myself, we need to work really hard at getting the evidence out, making it clear, what the dynamics are at schools, what the medical evidence points to in terms of transmission, and also being frank about what we don't know. I mean, we know that children below age 10 barely transmit the virus. Adults obviously do. What happens between age 10 and 20, we don't really know. And that is a concern, especially for secondary schools. But I think we need to pay more attention to bringing the evidence out there, explaining it clearly. And I think the way the World Health Organization's video clips have been misunderstood recently, I think is not a good sign.
Professor Martin Gustafsson, thank you so much for your time this afternoon.